have been hired, blueprints have been drafted, but there's a snag. All of this is happening with no specific location. Since the majority of the hospital's patients have been Cleveland residents, local mental health advocates say the hospital should stay in the city limits. But that idea has met some resistance. Meanwhile, at least one Cleveland suburb is jumping at the chance to get the hundreds of construction and professional jobs that would come with the project. So what's going on here? We learn more from Ideastream health reporter Ann Pinkerton.
Northeast Ohio's mental health hospital was built to treat tuberculosis back in 1922. Its emergency entrance, often the first thing people see, looks about as friendly as a police station, and it's emblematic of the whole building.
Notice how broken up it is? There's no easy flow for a gurney, easy flow for a stretcher, someone in a wheelchair, somebody being assisted in here. It's just chopped up. It's broken up. Our exam room is over here. Interview rooms are over there. It doesn't flow like a good emergency or a good admission wing where patients are brought in, they're comforted, there's a calming area.
Paul Guggenheim is the man charged with running North Coast, and he says it's completely inadequate for its purpose. Group therapy rooms like this one are shared with other programs, and the wards and personal rooms where patients spend most of their time are small.
We do not have gymnasiums. We do not have adequate outdoor areas. We do not have indoor adequate areas for crafts and activities and aerobics and exercise, diversions for patients who need to kind of burn off some steam.
Patients can enjoy a game of basketball in an outdoor fenced-in area, but there's little shade here, and it's in the shadow of Metro Health Center's helicopter pad. Guggenheim says that's about as calming as a migraine.
We get the exhaust, we get the beating of the blades, the noise. If we're in group therapy, we have to stop group therapy. If we're in training, we have to stop the training for 5 to 7 to 10 minutes for everything to settle down.
The state of Ohio has set aside around $3 million for the design phase of a new state-of-the-art mental health hospital, and the hospital's largest client, the Cuyahoga County Community Mental Health Board, will choose the site. The state has green space it owns in Warrensville, and it's proposed that for the new site of North Coast, and that suburb is interested. That site's free, but it's nearly 20 miles southeast of Cleveland. Since 80% of the hospital's patients are from the city, the Mental Health Board says placing a new hospital in the suburbs is not only an inconvenience, it would be a huge missed opportunity for Cleveland's economy.
It's a wash, if not an enormous gain for the state to be able to do economic development and to do a facility where the people are, where people can come and work, where people can come and visit, and it needs to be in the city of Cleveland.
The Mental Health Board wants the new facility to be similar to the new state hospital in Massillon. This $60 million facility boasts plenty of natural light, common areas with fish and birds, and places for patients to exercise. Imagine that here. At 79th and Quincy, an expansive 25 acres are waiting to be developed. It's blighted and could cost around $3 million to clean, but the Mental Health Board thinks it's worth it. However, Ward 5 Councilwoman Phyllis Cleveland says a mental hospital isn't the right thing for this area.
It would be great to have the hospital located within the city itself, but the site that they were looking at, the community has other plans and other ideas that we've actually been looking at for a number of years, so it doesn't fit in with what the community wants.
Nearby residents didn't seem to have any objections at a public hearing on the matter, but Councilwoman Cleveland says she's received lots of negative feedback. She wants to reserve the land for commercial or residential development, even though none has come along for decades.
There are ideas always out there, and things that are in their infancy stages, but at this point not viable enough or far along enough to really talk about.
As it turns out, the land on Quincy is in Mayor Frank Jackson's old council ward, and part of it's actually owned by a good friend of his. But Mayor Frank Jackson has chosen not to interfere on the city of Cleveland's behalf in this issue, and he could be risking hundreds of healthcare and construction jobs in the process.
This position is simply him respecting that a council member generally knows what works well in their ward and what doesn't. And that he's been consistent in that regard. He was that way as council president. He was that way before he became council president.
Meanwhile, the city of East Cleveland is eager to tread where Cleveland won't. Here, 3 sites are available, all about 5 acres smaller than the Quincy parcel, but without the costly industrial cleanup.
There are contiguous blocks available for development that people want to see redeveloped. So we've already got the will, we've already got the desire, we've already got the need. Now what we need is the construction, the development, the facility. And again, the Mental Health Board can bring not only a quality facility, but it can rejuvenate and give a facelift to and an economic shot in the arm to an area that just absolutely drastically needs it.
The Cuyahoga County Community Mental Health Board's chair, Bonnie Kaplan, says she's disappointed that Mayor Jackson isn't fighting to keep over 200 healthcare jobs in Cleveland, and that he values political courtesy over economic health. If the situation doesn't change, Kaplan says, the board may settle for redevelopment in East Cleveland. Good for that suburb, and certainly more convenient for Cleveland's mentally ill than Warrensville. For Ideas, I'm Lisa